you're dealing with sciatic leg pain and your treatment has made it worse instead of better, you may be doing something that's keeping the nerve irritated. When that happens, the pain starts traveling farther down your leg. Recovery can drag on for months instead of weeks and days, and in some cases it gets so bad that surgery becomes a real possibility. In this video, I'll show you how to tell if your treatment's making your sciatic worse and the common mistakes that keep the nerve irritated, and what to do instead so you can calm the nerve pain, recover quickly, and lower the chances of it coming back. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario. How do you know if your sciatic treatment is making things worse? One of the biggest warning signs is that your leg pain isn't settling down. It actually may be becoming more intense. Maybe the pain has traveled farther down your leg than it did when this first started, or what began as occasional shooting pain has turned into numbness, tingling, or even weakness into your foot. Those changes tell me the sciatic nerve is becoming more irritated, not less. Clinically, we call this peripheralization. That simpler term means that your symptoms are moving farther away from your lower back and deep into your leg. Instead of pain retreating back towards the spine as you recover, it's heading in the opposite direction. Now, that doesn't automatically mean your treatment's making your sciatic worse. More often, it means the treatment isn't addressing the real source of the problem. Something important is being missed, or the right treatment isn't being done at the wrong time. That's actually good news because it means there may be a reason your recovery is stalled. And once you understand what's keeping that nerve irritated, you can start doing the things that help settle it down instead of continuing to aggravate it. The next step is understanding why this happens in the first place, because some of the most common treatments for sciatica can accidentally keep the nerve irritated without anyone even realizing it. If your sciatica isn't getting better or it's actually getting worse, there's usually a good reason. In my experience, it's rarely because people aren't trying hard enough. Most patients have already seen their family doctor, tried medications, gone to physiotherapy, or even had injections. They're doing exactly what they were told to do. The problem is that those treatments don't always match what's actually causing the pain in the first place. Taking medications and injections, for example, by the time the patients come into my office, they have been dealing with sciatica for months. And usually they started with medication like gabapentin or an anti-inflammatory of some sort. And if that didn't provide enough relief, the next step may have been a cortisone shot or an epidural injection. But there's nothing inherently wrong with those treatments. They all have a role, and in some people they can provide a lot of relief. But if they solve the problem, that patient probably wouldn't be sitting in my office. Does that make sense? The reason is that medications and injections are designed to reduce pain and inflammation. They can help manage the symptoms, but they don't remove the reason the nerve is still being irritated. In many cases, that irritation is coming from a bulging disc or a disc herniation that's putting pressure on the spinal nerve. And if that underlying problem is never identified and addressed, it's very difficult for the leg pain to fully settle down. Once the pain doesn't improve, the next step is often physiotherapy. Again, physiotherapy isn't the problem. In fact, I recommend it for many patients. What matters is doing the right exercises at the right stage of recovery. One of the most common things I see is patients being started on core strengthening while they're still in the most painful stage of sciatica. They're doing planks and side planks and bird dogs and bridges when they still have severe pain shooting down the leg and can barely move. Those are all good exercises and I recommend them, but I usually introduce them later after the irritated nerve has started to calm down. If you load the spine before the nerve is ready, you can continue irritating the disc and the sciatic nerve, making it harder for the inflammation to settle down and delaying recovery. When I step back and look at both of these situations, I usually find that they have one thing in common. Nobody has explained what actually is causing the sciatica in the first place. If the structural source of the problem isn't identified, it's almost impossible to choose the right treatment and know when to progress your exercises or understand why your symptoms keep coming back in the first place. That's the piece that often changes everything, and it's what we're going to talk about next. Finding the structural cause starts with a thorough assessment. Before you can decide on the right treatment, you have to understand exactly what's irritating the sciatic nerve in the first place. When patients come into my office with chronic sciatica, especially after months of trying different treatments without lasting relief, I don't begin by treating the pain. I begin by looking for the reason the pain is still there. That starts with a detailed consultation. I review any MRI reports or previous imaging. We talk about the symptoms and how they began, and what makes them better or worse, and how they've changed over time. Next comes the physical exam, and I'll assess posture, how you walk, your lower back, how it moves, areas of muscle tightness, and whether there are restrictions in the spine. And if need, I'll perform the neurologic testing that will help us to show how the nerves are actually functioning. From there, we'll do a detailed x-ray analysis of the lumbar spine, sacrum, and pelvis, and we'll check for anatomical leg length differences because these have structures all work together. The goal isn't to simply find something abnormal, it's to understand what's continuing to irritate the sciatic nerve. For some people, the biggest finding is an L4-5 or L5-S1 disc bulge that's contributing to the nerve compression. For others, I may find areas of spinal misalignment, pelvic imbalance, sacral unleveling, or an anatomical leg length difference that may be placing additional stress on the lower back. Those mechanical problems can contribute to ongoing irritation of the discs, surrounding joints, muscles, and ultimately the sciatic nerve. Once those contributing factors are identified, treatment becomes much more specific. I use targeted chiropractic adjustments to improve the movement and alignment of the lumbar spine, sacrum, and pelvis. And if someone has a true anatomical short leg that's contributing to the problem, I may also recommend a properly fitted foot lift to help improve balance throughout the lower back and pelvis. Over the past 25 years, I've seen many people with chronic sciatica finally begin to improve once the structural cause was identified and treated, especially after other approaches had only focused on relieving the pain. But treatment doesn't stop there. Once the nerve irritation has settled down and the structural problem has been corrected, that's when we can safely move into the next stage of recovery. This is where I begin introducing strengthening exercises like bird dogs and planks and bridges to help restore spinal stability and support the correction that we've made. Once patients are pain-free and back to their normal activities and feeling like themselves again, I recommend regular maintenance checkups and supportive care to help keep the spine functioning well, maintain the correction, and reduce the chances of the sciatica returning in the future. Over the years, I've seen this approach help many patients recover quickly and enjoy long-term relief from their sciatica. If you've been following treatment for weeks or months and your sciatica still isn't improving, the first step is to talk to your healthcare provider. Let them know that your symptoms aren't resolving and that you're looking for a different approach. If the structural cause of your sciatica hasn't been thoroughly evaluated, ask whether referral to a chiropractor with experience treating chronic sciatica would be appropriate. If a referral isn't available, ask family or friends for recommendations or look for a chiropractor in your area who has experience assessing and treating chronic sciatica and lower back conditions. A thorough assessment should include a detailed history, a physical exam, and when appropriate, imaging to determine what's continuing to irritate the sciatic nerve. Once the underlying problem has been identified, treatment can be directed at the cause instead of simply managing the symptoms. In my experience, when the underlying structural problem is identified and treated appropriately, many patients begin noticing meaningful improvement over the first 12 weeks. While every case is different, recovery depends on factors like the severity of the condition and how long it's been present. I've commonly seen patients reduce their pain by 50 to 80% during that time. The important thing to remember is this: if your sciatica isn't getting better, don't assume you just have to live with it. It may simply mean the real cause hasn't been identified yet. And once you understand what's keeping the nerve irritated, you begin the right treatment, get back to doing things you enjoy, and greatly reduce the chances of your sciatica becoming a long-term problem. Today you learned how to recognize when your sciatica treatment is actually making things worse, why some common treatments fail to address the underlying problem, and how to find the real cause of your sciatica and what to do next if your symptoms aren't improving. The goal is to calm the irritated nerve, recover faster, and reduce the chances that your sciatica is coming back. Which part of today's video helped you the most? Was it learning about peripheralization or understanding how to find the real cause of your sciatica? Drop a comment below and let me know. If you found value in this video, please give it a like and a share with someone dealing with sciatica leg pain. Doing that helps more people find practical non-surgical solutions that may help them move better and feel better. Be sure to subscribe if you want real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms so you know exactly what to do next. Now, if you'd like to learn how an anatomical short leg can contribute to sciatic leg pain, go watch this video next. I'll explain how it can affect your spine and pelvis and how correcting it may help reduce ongoing nerve irritation and improve long-term recovery.